Yeah, so I actually had a patient who was a nurse, and she would come in she would come in to visit every day, and basically during report the offgoing nurse had mentioned that he had a nurse that was always present, and that she just was letting me know that the would make comments about our care and kind of correct us on how we were doing things or say that we weren't doing a good enough job. So, going into that situation, I wanted to really go into it with an open mind and be very conscientious of how I approach the care of this patient because I knew that there was going to be this bit of mistrust between his and us based off of what I'd heard. So I just made sure to go into it with a very non-threatening, open-minded, warm demeanor. And sure enough, when I went in, she was questioning me because I was a student nurse and saying, "Do you know what you're doing?" And I could tell there wasn't trust. So throughout the shift, I was building the trust with her by including her in the care. So I asked her, "How would you prefer that we do this for your or is there a certain way that you like this done?" And I was allowing her to participate where she could, such as like providing a towel for her father's head or getting his stuff for his bedside table. And I think that doing those little things to kind of ease the tension and help her regain a little bit of a sense of control really mended the relationship because as the shift went on, she did begin to trust me and warm up. And even partway through the shift, she started joking with me and we were telling nursing stories. And I think that finding that connection and middle ground with her where I was able to include her in the care made a big difference. And I think that when I'm approaching a situation with somebody who's got like a bit of fear or mistrust, that it's very important to remain calm and warm with them. I feel
Um,
like I circled back again. I do that.
do we want to use the word control explicitly? I feel like it
Maybe
has a
not.
connotation.
Yeah, that's true. Um, I think what I was thinking of is like she probably felt helpless.
Yeah, maybe you could, instead of saying control, maybe that you did some things to kind of help with that feeling of helplessness that she had kind of expressed through sharing her experience of watching her go through this.
Okay,
Give her things that she could do to
definitely.
actively participate in the care.
Actively participate. I like that.
Yeah.
Okay, great.
Okay, cool.
During my same clinical rotation, I had an older patient admitted for a and the family had very holistic views and they were refusing a lot of treatments. So they didn't want their mom to have antibiotics, they didn't want her to be catheterized. And there's just not really like pretty much everything that we went in there to do. The the daughter and the family was like, no, you're not doing that to my mom. So we went about this. I know we went in there and we took care of our other patients first because this patient had been taking a lot of time because we would have to like sit and talk a lot. So we took care of our other patients first and then we went in and we sat in there and we just gave them all of the information and just let them know like she needs antibiotics because of this and she needs to be catheterized because she hasn't urinated this entire shift. It's building up. And we asked them if they would be okay with a bladder scan. And we informed them that it's non invasive, it's just on the surface, and it doesn't have any potential to cause harm. And if they would be okay with that. So we did the bladder scan while the family was watching, and they were able to see the results on the bladder scan that was showing how much urine she had in there. I think she had like ml. And the family, they didn't really grasp what that meant, but my nurse and I explained it to them that that is a lot of urine in there and she needs to get that out. And their mom, they were very upset because their mom wasn't completely, and she usually is. And we were able to educate them that that's probably because she has that's not being treated and that that's a very common side effect. And after we sat in there for probably about 25 minutes just speaking with them and explaining everything, the daughter ended up saying okay, and we were able to start the antibiotics and we were able to cath her.
Okay, I really like this one. So for the antibiotics, do you know, was it like a broad spectrum or did you already have like a tailored one based on how long it took, like from when you got the cultures to when they actually agreed to it?
I honestly don't know if
Okay.
it was like what antibiotic it was because this was like a year ago.
Okay. And how much was the doctor involved in this?
The doctor was not really involved because he had gone in there and just told them about it. And they were like, no, I'm not letting that happen to my mom. Like, we're not giving her that. And then he would just be like, okay. And then he would leave. So it
Hmm.
was very like an unproductive shift for a while. Like, nothing was getting done. And we just didn't really understand why she was in the hospital if like they didn't want her to get care.
It sounds like mainly the education piece was what turned them around, and
Yeah.
your interventions that you're doing are focused on reducing harm.
I could probably add that it was important for us to respect their decision, but give them all the information that they need to make an informed decision.
Yeah, because then the more information that you have and the more you understand what does each option look like down the road, then you're more able to pick the option that best aligns with what you actually want. And then once they make that decision, your job is to respect that and then try to provide the best outcome that you can. You could use this for a bunch of different things. You could use this for a time you provided family-centered care, a time that a family member was unhappy with your care, a time that you could not perform evidence-based practice, and then you talk about how in the end you were able to. Maybe a time you had a patient with different beliefs than yours. Okay, cool. This will be a really useful story. What if they ask like the family version of this? Like, tell me about a time you had a family member who was unhappy with your care and how you turned the situation around.
So if there was a family member, I would first try to,
Would you
uh,
have like a situation though where a family member was
yeah, it was during my rotation at school. They're my clinical rotations.
yeah.
I had this patient where the mom just didn't really feel comfortable with the nursing student doing the nightly because we were night shift. So then the mom didn't really feel comfortable that a student nurse was caring for this newborn baby. And I first I came up to her and I introduced myself like, "Hi, my name is and I'm the student nurse for today. And if there's any concerns, like just please let me know, and I'd be happy to assist you in any way possible." And I immediately told her that I'm here to just to check her routinely vitals before like it was the night started so she could rest for a little bit. And I'm gonna be honest, like that was probably my first time ever trying to start the vitals on a baby, and I never expected like the baby to start crying everywhere. And I think that that moment, the mother just thought that I wasn't really skilled at the time, and she just was honing over me and just didn't really feel like she wasn't comfortable with me touching her baby. And it was I totally understand. And I asked her, like, is me caring for this baby, like, is this causing concern for you? And she's like, honestly, like, with no due respect, I just don't feel comfortable with you caring for my newborn right now. And she asked if I can bring in a nurse in this scenario. And from what I learned from this scenario is that, before I just actually start initiating like my actions, I would rather just tell her what I'm going to do. And if there's any concern she has, like I can, address it right away before I accidentally touch the baby. And because then she ended up crying a lot. And I think that caused the mom to have like some sort of anxiety around me.
You answered the question, but like I don't know that it necessarily does much for showcasing you. You know what I mean?
Okay.
It,
Yeah.
it's cool if it's, you turn it around with some sort of like education that like helped build the trust and build the rapport, or like, sometimes people talk about like I was editing a video on the plane about this girl who was talking about how she saw a family member in the hallway who was upset because, and it wasn't her patient, but the family member was upset because their mom had been sitting in urine for 20 minutes. So she, um, helped them. And then she talked about, saying like, thanks for bringing this to my attention. I'll be around if you need anything, so sorry again. Like, or people talk about, if they had to do wound care maybe, and they say, oh, I don't want the student nurse. And then they start educating on all the pieces of it. And then they kind of warm up to them.
Okay. Think of it now. I think I did have one. Actually, during my basically what had happened was the mom was the patient and the daughter was just like the visitor. She noticed that her mom had some sort of rash underneath her diaper around like the diaper area. So then
But just say in her groin.
in her groin.
Yeah.
And I noticed, and I, at the time, I wasn't. the nurse. I wasn't the student nurse for this patient, but the way this hospital was, it was a two bed. So it was like one room and then like a curtain on the other side. And since my patient was on one side, I asked the daughter, like, is everything okay? I noticed that you were kind of upset. Is there anything I could help? And she said she noticed that her mom had some rash around her groin area, and she's been telling the nurses that's really painful, but I guess the nurses really haven't been paying attention to her. So I called my nurse because my nurse was right outside the door, and I said, "Hey, this patient here, I noticed that she has like some scars or rashes around the groin area, and she's been saying she's in pain." And afterwards, the nurse noticed that it was like a serious rash. So contacted the doctor and tried to take initiative action to help alleviate this from further progressing. And I think at the end, the daughter really thanks me for just trying, even hearing her out and noticing before quick to judging. And at the end, I educated her that sometimes these rashes could happen from like if the diaper hasn't been changed for a while, or if there's urine that wasn't cleaned properly, and that could happen as well. So at the end, like I was able to educate her on why these rashes happen, and I was able to build rapport with her, tell her that if there's any more concerns, I'm going to be here for the next 12 hours, so you feel free to let me know if you need anything else.
Okay, yeah, I like this one way better. I don't want it to sound like you and your nurse went straight to the doctor instead of talking to her first. So maybe say you brought it up to the nurse, you asked if it would be easier or if she'd like you're happy to page the doctor for her.
Okay.
Uh, and she said that would be really helpful.
Okay.
Because then it sounds like you're being a team player rather than like swooping because you thought she was incompetent or something. You know what I mean?
Okay. So, um, before like, but so letting the nurse know, and then page like asking her if you would like me to page a doctor for you since you're busy right now. That's not
Yeah, yeah, yeah.
Oh yeah. Okay.
And then so typically what happens with these groin rashes, it's usually like in the creases, and it's
Yeah.
because the moisture just sits there and
Yeah.
the moisture kind of breaks the skin down. And then often what happens is like fungal growth makes it worse, you know what I mean?
Yeah.
So
Yeah.
typically what they'll order for that is I don't know if you've seen them do nystatin powder, the like white
Yeah.
powder.
I've seen the dry white powder. Yeah.
Did they do something like that or like zinc paste or what did they do to treat it?
Um,
Botrytis?
I unfortunately like I wasn't there to see it, so I
Okay.
had to go on lunch after, and when I
Oh,
came back, the nurse was like, "Oh, we finished it. Like, don't worry about it."
okay. Okay. Maybe you can say that if you want. It doesn't matter if you do or don't. What I see a lot of people do is they'll say, and I told her we're doing the best that we can, which feels very like, ma'am. You know what I mean?
Yeah, totally. Yeah, yeah. That's what I'm
Like,
getting.
yeah. But you didn't do any of that, which was good. Yeah, just, say whatever you said to her, something that has the vibe of like, that's really helpful that you let us know. Thank you so much. We really appreciate it. Something where she's like, okay, I did good, you know,
Totally. Okay.
versus like that nurse hates me. No one listens.
Yeah.
You know what I mean?
Uh,
Um,
It's bad news. She doesn't want to listen to me. Yeah, I get it.
okay, cool. I've gotten a lot of great feedback from you guys about the questions list with the 72 questions. You guys can get that for $3, by the way, with your discount code YouTube. And I wanted to build something for you where you can build out your answers on your phone that's really easily accessible. There's 33 of the most common questions that I put into a Notion template. If you don't use Notion yet, you should check it out. It's a really cool app similar to the Notes app, but it's very customizable. You can add pictures to it, you can change the colors, make it look how you want it. For each question, you get guidance on things to include, things to avoid talking about, example answers, and then there's embedded YouTube videos where you can watch other new grads give their example answers. And there's a notes section where you can type into and save your draft of your answer and start building your answers when you're waiting for the bus or you're waiting for post conference to start or you're in the kitchen cooking pasta and waiting for the water to boil, or just whenever something comes to you, you can just put it right in your phone in a way that's super easy to go through. You can also use the Notion app on your computer browser, you can use it on a tablet, but I wanted something for you where you can just little bit by little bit, or over the course of a night, if you have an interview tomorrow, start building out your answers in a way that's easy to break down with a lot of examples to help jog your memory for examples from your clinicals that you may have forgotten about. This is just a very streamlined way to start throwing in ideas and how to build out your answer in a way that's going to be very easily accessible on your phone.